Hello and welcome to this conversation on the COVID-19 crisis and challenges to the common good, hosted by the Berkley Center for Religion, Peace, and World Affairs at Georgetown University. I am Michael Kessler, Managing Director of the Center and a faculty member in the Government Department and the Law School. I'm joined today by colleagues from around the country who are esteemed ethicists working in the Christian theological and philosophical tradition. More detailed biographies are on our event page on our website. Joining me is Lisa Cahill, J. Donald Monin Professor in the Department of Theology at Boston College, David Hollenbach, the Pedro Urrupe Distinguished Research Professor in the Walsh School of Foreign Service at Georgetown, a fellow at the Berkley Center, and an affiliated professor in the Department of Theology at Georgetown. Grace Cow, Professor of Ethics and Director of the Center for Sexuality, Gender, and Religion at Claremont School of Theology. And Daniel Solmasi, the inaugural Andre Helligers Professor of Biomedical Ethics, with appointments in the Departments of Philosophy and Medicine at Georgetown. And he serves as the Acting Director of the Kennedy Institute of Ethics and holds a joint appointment at the Pellegrino Center for Clinical Bioethics. COVID-19 was barely mentioned in the dawn of 2020. Early indications of an outbreak in Wuhan, China, soon caused alarm bells to be rung by epidemiologists concerned for possible pandemic-level outbreaks. As we all know, that nightmare unfolded in February and March, grinding global travel to a halt, wreaking havoc on local and global economies, and causing untold suffering, pain, and death. As of early April, some areas of the early outbreaks in China and places in Europe are starting to see some signs of hope, with flattened curves, decreased incidences of new cases, and some even restoration of normal life. The United States is currently in the midst of a total ascent of cases and death rates. As theological and philosophical ethicists working with the resources of the Christian tradition, we're focusing this conversation around a number of issues related to the common good. What has the pandemic revealed about our notions of the common good, and how can that notion be sustained as a moral idea in the face of this insurmountable loss? Just so we're clear about terms, what do we mean by the common good? We're going to unpack a lot of that today, but I want to point first to the principles of the Church's social doctrine, which, quote, constitute the heart of Catholic social teaching, and how the common good refers to the ultimate and organizational foundations of life and society. Building from one principle, the dignity of the human person, that is, the Church sees in men and women, in every person, the living image of God himself. The compendium of the social doctrine of the Church builds out three other principles: the common good, subsidiarity, and solidarity. And I quote, "The principle of the common good, to which every aspect of social life must be related if it is to attain its fullest meaning, stems from the dignity, unity, and equality of all people. According to its primary and broadly accepted sense, the common good indicates the sum total of social conditions which allow people, either as groups or as individuals, to reach their fulfillment more fully and more easily." Responding to the pandemic has required a collective moral sense of responsibility for each other. So-called social distancing, which is in reality physical distancing and attention to personal hygiene and actions and how those affect others, is in reality a profoundly moral and social act. We're not social distancing, but being deep caretakers of others. The health of our fellows and ourselves requires sharing responsibility for one another, especially in staying home so as to not transmit the virus to and from strangers. There have been hard questions in the past about how this solidarity is created and sustained, especially in a global, pluralistic context. What, in the face of this pandemic, cultivates and sustains this solidarity? Responses to the COVID-19 pandemic have also illuminated a collective and global moral sense of responsibility, even while strong currents of individualism resist the implementation of social distancing and other measures. The pandemic has demonstrated the absolutely essential nature for infrastructure and coordination that political and social institutions provide for collective will formation and collective action. What resources do religious communities and theological ethics provide for addressing these challenges? Further, large-scale healthcare disparities based on demographics and income inequality in particular have exposed severe shortcomings in social and political infrastructures. Even as we're all in this together, some enjoy great advantages, some are much more vulnerable. How can religious and theological ethics address these crises? How are these conceptions of the common good across various national and cultural contexts brought together to address this crisis? Our conversation will take us through many of these issues and many more related topics. So first, let's dive into this broadest question. What has the pandemic revealed about our notions of the common good? And what are the challenges and the possibilities for this moment?
Well, I could start off. This is David Hollenbach speaking. I think one of the things that the pandemic, the COVID-19 crisis reveals is how interwoven our well-being is, or the well-being of one person is so deeply interwoven with the well-being of others, that in a sense, we can't make it to a healthy life unless others who are near us and around us are also able to be healthy. So the health in a certain sense of that we're talking about in addressing the COVID crisis is a health that is our health, not just my health or your health. Now, I'm not trying to say that there aren't distinctions between the health of one person and another. There clearly are, and some of the people are able to achieve greater health than others are in the face of the crisis because of the conditions under which they're living. But there's an interconnectedness between us that means that certain key elements of our well-being are necessarily shared. I think it pushes us to recognize that the goods we're talking about when we're talking about response to the goods that are threatened by the COVID crisis are goods that belong to us. They're the goods of a we, not just the goods of a me and of a you, but of a we, of an us. And that's the common good that we share together that is really crucial at this point in time in facing the COVID-19 crisis.
I've got to get used to unmuting here. I'd say that I think it is, as a pandemic, something that affects all of us and requires collective action. And that calls for ethicists and others to say something about the needs to serve the common good. But it struck me that it also reveals the differences in our conceptions of what the common good actually might be. And I see this, for instance, in rationing protocols that lead people to sort of reveal their sort of utilitarian views of the common good, with many of them calling for rationing that would exclude elderly people, exclude mentally retarded people, and maximize quality-adjusted life years or even social worth. There are also sort of libertarian calls in the midst of this. Libertarian conceptions of the common good are just what the narrow bit that we share in common that's necessary for us, but that's it, right? And so you see people writing about the real problem being the change in the economy that this is creating, that it is because we're concerned about the public health and instituting all of these public health measures, we're tanking the economy, and in the long run, that's actually going to harm more people because of the joblessness that it will engender, et cetera. And so fixated on the economy that they think that, well, you know, if it's just the elderly and the disabled who are left behind by this, or then it's okay. Somehow we'll just live with that because that's what nature and the market produce for us. Then I think you can see in authoritarian views of the common good, and you see that in China, right, where we're going to bring in the army, we're going to drag grandmothers who disobey this out of the way. We're going to use invasive surveillance techniques to find every contact, and we'll wipe out the virus that way. But I think that probably all of us who are on this call would share something that I think David was kind of describing, which is a sort of what I would call a holistic sense of the common good, in which the common good isn't something like the state over me as an authoritarian sense. It's not just the narrow things that we might share like a libertarian. It's not just the sum of the atomistic individual goods the utilitarians would have, but a sense in which my good is partly constituted by the good of the whole. Right? And that I am connected to the whole in that deep way, and that the common good itself recognizes the goods of individuals and their rights as well. And that's the kind of sense of the common good that helps us to flourish, and I think gives different answers to all those kinds of questions.
I have a question, and it's a question I'd like to pose to Dan. And it's not really a philosophical question. It's a question about the practical and real circumstances in which we're talking about the common good. And we don't necessarily talk about that only within the context of acute care. But if you're talking about rationing, that's what I want to ask you about, because it's not my immediate context. And so what I have heard, and I'm just a member of the public, I don't have any special medical information or exposure. So I've heard Sanjay Gupta, on CNN, or I've heard a physician being interviewed on NPR this morning who was talking about potentially decisions having to be made about scarce resources. And Sanjay Gupta said 80% of people who get put on respirators, unfortunately, still don't survive. So only 20, he said that the information is tentative, not like there have been conclusive studies, but that's what it looks like. And the physician on NPR said that he was working with a group that was trying to refer these decisions to a committee in the hospital rather than the individual doctors, because there's just too much pressure while they're having to give all of this urgent care. So that's one issue. But what I wanted to focus on is, he said, people are potentially going to be in situations where they cannot give everyone a respirator. So, sheer equal respect, I guess, would just be first come, first served. But he said there's some circumstances where the person is probably not going to survive. I mean, immediately. So he said we might be looking at length of life and effectiveness, not in terms of total life years, but can they survive this illness, and will they have sort of a reasonable, prospect of continuing in the short term. So my question is, yes, there are all these philosophers or pundits who are talking about more extreme interpretations, but at the concrete level, what are the ethical and decision-making issues really like? Concretely, what are we really talking about? Not what are some, philosophers or other commentators in some other context trying to put out there, but concretely.
Yes, well, these questions are very real, and they're not abstract. And so there are states and hospitals that are putting out guidelines for doing triage, many of which are saying you should incorporate life years into the calculation very explicitly. The Spanish guidelines said incorporate social worth into your decision whether to ventilate somebody. I mean, I'm not talking about something that's purely abstract. We're talking about what people are actually suggesting in ways that I think are really morally problematic. My view is that what we have to do in this case is not think that because the circumstances are extraordinary, we change our ethics.
Yeah.
Rather, that our ethics need to be the same ones that we've always relied on, and we apply them to circumstances that are extraordinary. And in extraordinary circumstances, we need those principles more than we ever did. We don't want to change them and jettison them. We want to apply them as best we can in extraordinary circumstances. And so my view about rationing is that it should be based on need, it should be based on prognosis, and based on effectiveness. So the need would be the same as we usually do, whether the person actually needs a ventilator or not. We don't want to waste resources if they could be managed with something less than a ventilator, et cetera. The second is their prognosis. Is this person someone with terminal non-treatable cancer? Are they at the end stages of dementia, bedbound, unable to recognize other people, with a life expectancy of months? So that even if they were to survive, we're not talking about 30 life years or 10 life years, we're talking about weeks or months. Maybe we want to sort of say that those persons wouldn't be candidates. And then finally, the effectiveness of the treatment. Is this person, as you were suggesting, likely to be someone who will survive being put on a ventilator and get out of the hospital? And those, we have reasonable ways of sort of calculating the risks for that, and trying to implement those kinds of sort of basic medical decisions to decide who gets it or not. Last, I have to say that we hope and pray, and this is why anybody who's not a doctor who's listening in on this, flatten the curve so we don't have to do this, right? Do what you're supposed to do as citizens so you don't have to face the rationing question.
Yeah. I mean, just to sort of affirm part of what you said, prognosis and effectiveness are kind of the same thing. I mean, on one level, and they do converge with a very traditional principle of Catholic bioethics. I wouldn't say it's exclusive to the Catholic tradition, but it's that you have to look at quality of life, but also reasonable hope of benefit.
Yes.
What is a reasonable hope of benefit? And survival for weeks or months might be a benefit if there were unlimited resources, but while there are very scarce resources, I think that putting the hope of benefit estimation in a social context is a reasonable thing to do.
Yes, I agree.
If I could jump in, so the criteria that you name seem appropriate, and I also do not have expertise in this area, but I'm like a member of the educated public reading about the disproportionate effect on African Americans, right? There have been reports about the higher rates of infection and death in places like Chicago and Wisconsin. And that, I think Dr. Anthony Fauci said it's tied to underlying medical conditions, right? Diabetes, hypertension, obesity, asthma. So how would, on the level of clinical care, how would you incorporate, how would you factor that in so you could decrease the disproportionate impact on vulnerable communities while still maintaining these standards of care or these principles that you had before the pandemic? I hope that question made sense.
Yes, no, it's a good question, because certainly people who are of advanced age, for instance, are at higher risk of dying from this disease. There's no question about that. And so it gets a little tricky that you don't want to sort of say there's an absolute age cutoff, but to some extent, age is a factor in assessing whether the person is going to benefit from the treatment or not. But it stands really in some ways not as a criterion in itself, but as a surrogate marker for the capacity of the immune system, the ability to generate stem cells and recover, and all those kinds of things that are associated with that. Diseases like hypertension and diabetes are very common, for instance, in the African American community, and predispose people to getting the virus. But when one is assessing whether or not the person is going to survive, those tend not to be the kinds of predictors one relies upon. One relies upon, right now, what's the level of oxygen in this person? What is their blood pressure? What is their temperature? And we've seen people in our hospital whose temperature goes to 106 degrees in what's called a cytokine storm. that has nothing in itself to do with diabetes, even though somebody who is diabetic might be more predisposed to getting in that condition in the first place. So we're looking at medical criteria that really relate to the present condition of the person rather than the predisposing factors that might lead them to be in that condition in the first place. Does that make sense to you?
Could I add in on that? To build on what Grace, the question that Grace has raised. When we look at the question of the common good in relationship to the COVID-19 crisis, one of the questions that could emerge here would be when we're talking about who has access to certain elements of the common good, we also need to consider, like, what are we talking about having access to? It could be access to ventilators, or it could be access to the basic conditions of human life that mean that African Americans are not made more vulnerable to having their lives threatened by the COVID virus. Or it could be an area that I've spent a lot of time working on about, there are 70 million displaced people and refugees in the world. Many of them in the world are living in refugee camps where people are squeezed into tents, 10 people at a time in a single tent. Now, clearly, if we're talking about distancing, being 10 people at a time in a tent is not a very good way to avoid getting infected. And so the question then becomes, how do we take steps this is part of the common good. It has to do with whether these people who are in those tents in the refugee camps are able to share in the kind of shared good of access to healthcare and access to a decent life. And so that puts us up against a big question about, we have these ventilators here in the United States and they cost, what, $40,000 a pop or something like that. But an adequate residence for a refugee is a much cheaper thing to provide. And then but the question would be, do we take those considerations into account in thinking about these larger questions of the common good? And another way of putting it is, the common good of whom? Are we talking about the common good of our community here in the United States? Are we talking about the common good of the upper class in Westchester County outside of New York? Are we including the people who live in the South Bronx? Where are we drawing the boundaries about the distribution questions? And I think those are part of the justice issue that's involved here, that it's surely, I'm not trying to minimize the points that Lisa and Dan were raising about who gets access to these particular medical cares, provisions of certain kinds of medical care, and they're very important questions. But we also need to consider the larger set of issues about the relevance of what country do I live in, what's my citizenship status. I mean, the people on the border between the United States and Mexico right now, especially those on the Mexican side, are in very great danger, and those who are being detained because of their effort to seek asylum in the United States are very vulnerable to COVID-19 and to the disease. And we need to look at those questions as well. And one of the ways I like to put this is that this crisis that we're facing serves as a kind of it's a kind of X-ray of our society. And one of the things it does is it reveals some of the deep structural injustices that are already present in our society. Doesn't mean to say that COVID crisis is a reason why we suddenly have to become concerned about these in a way that we weren't before. It does mean that, but it shows us some of the deeper structural injustices that are already present. And it challenges us to try to respond to them. in addition to serving as a kind of X-ray, it also serves as a kind of magnifier, because some of the people who are particularly vulnerable to issues of poverty and inadequate health care and so forth, their vulnerability is magnified by the COVID crisis. And those who are already vulnerable are more vulnerable than they would have been if we hadn't had this crisis. So when we look at the common good, I think we have to think both about the issue of triage and rationing of things like ventilators, or even hospital beds, which we might be up against in certain parts of the country. But we also want to look at those larger questions that have to do with what are the economic well-being of people that affects their health, what is the citizenship status of people and how does that affect their health today, what is about the displacement status or refugee status of people and what does that do to people, the political dimensions. I mean, I noticed that just a couple of days ago, a group of major diplomats, including Madeleine Albright, a former Secretary of State, has called for the United States to cease the kind of economic sanctions against Iran because the COVID crisis is so severe in Iran that large numbers of people are not getting access to the health care they need because of the economic crisis that's facing Iran right now. And Madeleine Albright and some other diplomats from the UK and France and so forth have said we ought to back off some of those political sanctions in order to try to help the people who are in danger of dying because of the COVID crisis that's facing so many people in Iran, which is one of the centers of the COVID crisis right now in our world. So all I'm suggesting here is, as we talk about these issues, it's the issue of triage regarding ventilators is a very important question, but there's a set of questions that are also broader economically, politically, and socially that we also need to keep in mind as we address this question.
Yeah, you're absolutely right that even having the opportunity to discuss triage and ventilators is already a luxury, right? Because there are plenty of countries where the vast majority of people have no access whatsoever to any ventilators, and we need to keep the broader picture in mind.
I mean, I think, so one thing that I'm really interested in is how to motivate different political behavior or what causes political behavior. And I think we've been talking about the very near and the very distant facets or aspects of this health crisis. I mean, distant from us here in the US or those sitting in our particular positions. So on the one hand, for instance, if someone comes into a healthcare center in the US and requires a respirator, a decision has to be made on the basis of their immediate prognosis, need, and the effectiveness of the treatment. But there could be, as Grace was saying, larger justice questions about how they came to be in that position in the first place. But at the point of contact, those can't be resolved. You know, that's a bigger political and social issue. And similarly with the people in Iran and the sanctions. And one thing that I'm very conscious of, I think as I get older, I'm even more conscious of this, that we or I, you know, to take my own example, for over 40 years have been talking about the common good and theories of the common good and justice and who deserves more attention and the preferential option for the poor and intersectionality and a race, gender, class lens and all these things. But the bottom line is we're academics talking about these things. And I've come to realize that, you know, the real issue or the sort of critical point is not defining the edges. You know, what is the big theory or what is the universe of ethical principles and what do we do in extreme cases? But even if you take cases that from an ethical or humanistic or Catholic social teaching standpoint are clearly right. It's right to do something. For example, to relieve the pressure on the people of Iran, as David was just saying, which is the center of COVID, or provide better conditions in refugee camps. We can't get the public to really be motivated to act on the things that are clearly morally right. That's a big issue. And I think David was, very usefully gave the example of the diplomats and Madeleine Albright, because I think part of it is looking for windows of opportunity. Like where is it possible to gain social consensus and political will? Pope Francis said he was talking about the environment, but in Laudato Si, he said, the issue here is a lack of political will. It's not really figuring out what needs to be done. People give all kinds of lip service to justice toward refugees, but they're not willing to make tough political decisions that involve sacrifice or that put them at political risk. So I think the example of the diplomats, there was a window of opportunity, there was a need, and they had the ability to put their moral authority and their influence behind it, and maybe they can make some progress. But, as usual in our society, people tend to look at the interest of their more immediate communities of affiliation. And that's where the solidarity is. So I live in Newton, Massachusetts, which is somewhat diverse, but by and large, it's a middle to upper class suburb of Boston. And here in Newton, we're solidaristic and we avoid each other on the sidewalk and we're all doing what we need to do. But I don't know if we have the same level of concern for other people in the Boston area that are in different communities, maybe different social, ethnic, racial class or whatever it might be. And so we recognize in the abstract the African Americans that Grace mentioned in Wisconsin and Chicago. And we think that that's unfortunate, that's unjust that they're suffering these adverse health conditions. But how do we, we're all academics, how do we, or those that we are in contact with, really motivate different political behavior? That's a huge issue. And a sort of stumbling block in a way for Catholic social teaching, or that's the challenge I think Laudato Si really throws out there. There's all these UN resolutions, have not gone anywhere in the environment. Similarly on global health, there's all kinds of UN declarations and so on. But motivating real political change, I think, is what we're looking at.
Just a brief comment maybe on that to show you how tough the job is. I was once on a National Academies of Medicine panel discussing trying to get more funding for hospice. And I was saying, well, what we really need to have here is a principle of medical ethics. Maybe we should call it solidarity. And I was told by the organizers, no, you can't say that because Americans will read that as socialism and we'll never get anything done politically.
Yeah.
So that's the level of resistance, which is really strong.
That's one of the things, though, that this crisis may help us change. It seems to me that people are aware of the fact in a way that's probably more vivid than has been the case for a long time about how interdependent they are on each other's behavior. The fact that people know now that they have to wash their hands frequently, not just to protect themselves, but to protect their families and their neighbors and other people they interact with in the supermarket and so forth. The fact that we know that this virus came here from abroad, it could lead to two different kinds of response. It could lead to, unfortunately it has among some people, to a very anti-Chinese attitude, saying it's the Chinese virus and therefore let's find a way to penalize the Chinese for this. But with the right kind of leadership, it could go the other way, to say that because we are interconnected and vulnerable internationally, we have to recognize we have to create institutions and structures that enable us to deal with this question internationally. That's what happened after World War II with the terrible disasters that occurred in the Second World War, led to the creation of a set of institutions, the so-called Bretton Woods institutions that were designed to try to respond to the global economic problems, to the creation of what became the European Union, to try to prevent the European countries from falling into economic and therefore ultimately political and military rivalry with each other. That a series of institutions emerged out of the sense of vulnerability after the Second World War that unfortunately some people want to dismantle today. But I think what it points to is if we take our vulnerabilities to each other seriously, we could, with the right kind of leadership, move toward strengthening those international and forms of support for our mutual dependence and support for the regional and even global common good, I would put it. And I think we could go either way on this. It could become worse, leading to greater nationalism and more populism and greater exclusion, or it could go the other way. It could lead us toward a much greater positive response toward our international neighbors and our international support for the common good. So I think Lisa is right in asking the question. I'd say that we're at a turning point, and which way we turn is going to be really dependent upon the kind of leadership that comes from our politicians, that comes from our churches and our religious community, and that comes from our academic world. I think if we could get those three bodies of politicians, churches, and academy to really stress how these issues need to be advanced, we might be able to move toward a greater positive response to this crisis rather than a more self-defensive and therefore negative response. That's my view.
Right. David, maybe you should run for political office. I'm only half joking because I fear that the trends that we're currently in may go the other direction, right? There's already these, there's the disastrous move by the president, among others, to label this the Chinese virus, right? As a
Mr. Trump was saying yesterday that he wants to cut funding to the World Health Organization, for God's sake.
Which he did walk back later, but
I know he changed his position on, but even the idea of saying it seems madness to me. There's problems with the World Health Organization, I know that, but to defund it is not the way to solve those problems.
Right, but I think one of the things that this is magnified is, on the one hand, a kind of individualist versus collective narrative, that polarity is somehow driving all of this, right? With the Americans wanting to with most Americans wanting to have their liberty, not have restrictions, not have the social distancing regulations, versus the kind of, successes at flattening the curve in more so-called collectivist societies. But one of the things I think that kind of framework might elide is more of what I see a kind of nationalist, populist, what dare say, this is problematic term for some, but a kind of tribalism where, right, the first gut reaction by the political leadership of the country at the federal level was close the border, right? We'll just stop the border, that'll stop the problem. As much as Christian notions of solidarity don't respect borders, COVID didn't respect borders. And so both of those things, I think, push against this first idea that this kind of nationalist populist reaction where we're going to protect ourselves, we're going to protect people like me, we're not going to worry about the others. I think these notions of the common good that we're all dealing with cut against that deeply. But I think it's back to Lisa's problem. How do you then, right? We went through the cosmopolitan phase in ethics, and we probably are all deeply influenced by that. But we're back to this problem that Lisa raised. That doesn't change political will. That doesn't change political leadership behavior. How do we push the needle? Not even push the needle, but really push the entirety of the religious communities to understand the kind of solidaristic reaction to this problem. That I think, Lisa raised that issue. I think we have to really get purchase on how we do that, more than simply, we develop the theories and nobody reads them, or we develop the theories and very few, right? There's deep problems.
Give lip service,
right?
People say, "Oh yeah, fine, good," but then that's not a real motivator. That's
right. Yeah. Right. And there's deep problems, across, Catholic social teaching, or across, Catholic, the consistent ethic of life among the Catholic community, according to polling, is picked and chosen from, depending on, it tracks more the political leanings of the person rather than following, the church's teaching, right? So there's a kind of crisis of motivation and a crisis of legitimacy that most of these religious communities have. So.
If I could jump in and connect.
Oh, excuse me, Grace, you go.
Grace.
Okay, I was just going to connect some points that have come up, Lisa, with your question about how you appeal to ordinary citizens or inhabitants, right, to do the things that have to be done. And I mean, the older I get, what I'm seeing in the US is that it's a combination of reflecting on David's point about the interconnectedness, the we, but being connected to self-interest. So I'm hearing Republicans say things I never thought I'd hear them say. They are saying things like release nonviolent offenders in prisons, right? Because there was already an overcrowding issue. They are saying give relief to people so they're not kicked out of their apartments when they can't pay rent, right? So there's the stimulus check, universal basic income, unemployment benefits. I don't think it comes from a place of compassion toward the poor and vulnerable. It's not preferential option. It's that this pandemic is affecting more middle class folk, you know, and I guess maybe people are responding out of fear or self-interest combined with collective interest. I don't know. So yeah. I guess what I'm saying is what I do in the classroom is very different than what I'm actually seeing is working, right?
Yeah, right. I mean, I think one thing, Grace, is that as we're kind of talking, that example Dan gave of people saying, oh no, solidarity is socialism, I think, and then some of the other examples that came up, something that is going on is that people also interpret situations and understand the facts to be what they learn from the groups that they trust and the authorities that they trust. And I think one of the issues with the COVID-19 crisis is that even those who are in circles, who are more sort of gut level hostile to social programs, are realizing concretely that they too are at risk. So it's not possible to deny the facts in a way that you might be able to if they were not impinging on you immediately in your own environment. And I also think, and I think you're kind of suggesting this too a little bit, to get people, I believe, to get people or political groups or overcome polarization, but to get people to look at a different point of view and begin to incorporate it, you have to do more than argue with them or show them that in theory this is the correct answer. There needs to be a way to include others or attract others into a different affiliative group, so that they begin to trust other people, other groups, see things with a different worldview to some degree. And I think that's gradual. It's very rarely just they hop from point A to point Z all of a sudden. I mean, sometimes that happens. So the COVID-19 crisis is maybe interestingly creating some overlaps, bringing some facts to bear that otherwise might be denied. Like the president saying, oh, well, I'll be in church on Easter Sunday. And I don't think people are really talking about that anymore because Anthony Fauci really denied that. The Surgeon General of the United States, who I assume is a Republican, I don't really know, but he also has publicly said that's ridiculous. So I think that the facts, the personal thread, as you said, you have to appeal to self-interest, but then also that's beginning to break open some of these polarized identity groups a little bit more.
Let me give a great example of a way in which I think Grace's point about overlapping self-interest with concern for others may work here, is that maybe one of the lessons people can draw from this is that the best way to stop another pandemic from happening is develop the healthcare infrastructure of the developing world. Right? You don't want, if 1% of people are dying from COVID-19, 50% will die if this is Ebola. Right?
Yeah.
So it is actually in the self-interest, if you will, of Americans to actually do more for the healthcare infrastructure of the developing world for the sake of the world. I mean, that's what a pandemic is. It affects the world and maybe increases our global consciousness.
I really agree with that. And let me go back to giving another example of why I think leadership is very important in this regard. Just recently, I was in a course that I'm teaching. I was talking about how do we get countries to come toward reconciliation after war. And I was using the example of what happened after the Second World War, or at the very end of the Second World War, when the United States and Great Britain realized that they were going to win the war against Germany and Italy as well. And there were two major proposals that were made to Harry Truman, who was president of the United States at this point. One was from Henry Morgenthau, who was the Secretary of the Treasury at the time. And Morgenthau said, these Germans have started two major world wars in less than 40 years. The only thing we can do to prevent them from doing it again is to destroy the entire industrial infrastructure of Germany and reduce it to an agricultural society. George Marshall, on the other hand, who was the Secretary of State, said that's the exact wrong thing to do. What we need to do, even though Germany has done very bad things to us and has done very bad things with the help of Italy and so forth, and Japan also, we don't destroy them, we want to rebuild them. We want to make them our friends. And they did that. He wanted to do that partly because he wanted to put Europe back together again, to have a strong resistance to the Soviet Union, which he saw as a more dangerous threat. But the point is that I think if you had taken a vote at the end of the Second World War about whether to go with the Morgenthau plan of not only giving Germany nothing, but actually destroying all their industry, versus George Marshall saying, let's rebuild Germany at the cost of billions of dollars, most Americans would have gone for the Morgenthau plan because they said those Germans hurt us. We'd have to, but actually with the right kind of leadership, Marshall and Truman persuaded the country to go the other way, and we rebuilt that European system, and it went in a way that was in our self-interest. It supported our self-interest, but it was because the right kind of leaders enabled the country to move in what might be called its well-informed self-interest, rather than a naive sense of what our self-interest would be. And I think we're facing the same kind of thing right now about what our real self-interest here, if we want to avoid another COVID, is we have to improve the healthcare of the developing world and have to build better international systems for dealing with international health threats and so forth. And if we could persuade people through the right kind of leadership that will help them, it's not like they're being altruistic. The common good is not, as Lisa said in her earlier notes about this to us, it's not altruism versus egoism. It's all about us-ism. We're in it together. And that's what we have to really, really persuade people of that. And it seems to me with the right kind of leadership, we could show people more than we have that this is in their self-interest to move away from a populist, anti-Chinese and so forth attitude toward one that says, well, maybe Iran and China ought to have a different kind of response from us than they've been getting in recent years.
So I have some hope, because we're in the midst of this pandemic, that the American people will say, you know, it wasn't a good idea to gut the pandemic crisis team. We need to put more resources into this. So I have some hope of that. There are also some interesting thought pieces about whether the nation or the world could could mobilize to combat climate change, which is absolutely going to be, I mean, it already is a looming disaster and is projected to be far worse than, let's say, any COVID-19. And so then we return to Lisa's question, well, how do you mobilize for that? How do you get people to sign on to something that's a long-term interest? Maybe not in my lifetime or, you know, our lifetime, but our children and grandchildren, et cetera, et cetera. And then, sorry, I don't know if this is an appropriate topic given the convening, but for me, it's the same thing, right? We're transfixed on the health issue, but what about the next disaster? It might not be viral. It's this other thing.
Yeah, I mean, so to just bring it back to the topic of the common good, but also to address what you're talking about, just coincidentally, I was discussing this in my graduate seminar yesterday around the environment. And we were following off of the Amazon Synod and looking at some of the, you know, extractives industries and their destruction that they've caused, and then how is that to be addressed? And we looked at some cases. And what really emerged clearly is that there's got to be mobilization from below. This is another big message of Pope Francis. It's not enough to just keep trying to appeal to elites to do the right thing. So it's got to be very multi-pronged and interfaced and networked and decentralized. A political scientist that's written a lot relatedly is Anne-Marie Slaughter. So she has a book that's like over, I don't know, it's like 15 years old, but it's called The New World Order. And then more recent things have been written on this. And the whole point of it is that she's talking about governance. So governance doesn't just happen at the level of the nation state, and certainly not at the UN. But if you take it to Christian social ethics or Catholic social teaching, it's also, what are we really talking about when we're talking about participatory democracy for the common good, whether it's nationally or internationally? And it's really got to involve local action, local networking, interfacing with mid-level, and all sorts of governmental, nonprofit, you know, corporate or business interests even. Like there's an association of mining industry executives that's pro-social and interested in development. So that's on a different issue. But I think also on health and global health and COVID, you know, it's like, it's got to be very networked and broad, but not to neglect the pressure that is essential from the lower and mid levels, and that hopefully can gain force as it networks across different interest groups and, you know, cultural settings maybe. Because just appealing to the goodwill and the sense of justice of those whom the status quo is benefiting is not going to be adequate. It's important to do it. It's not adequate.
I would really want to echo that because I think that this, if you think back to the way this crisis emerged in the responses, right? Early on, epidemiologists and public health officials were clearly understanding the deep dangers. Hospitals were understanding the potential havoc. That the social institutions that pulled us into a somewhat adequate response were primarily, first and foremost, higher educational institutions deciding this is a real challenge. We can't have all these students coming back. And then you had this kind of domino effect once the university started announcing, right, the sports organizations suspended their seasons and corporations started promoting telecommuting and the like, and the state governors and the local municipalities, particularly the large urban local municipalities, started making these decisions. And all of this is moving along, dragging the federal government, which at least the political branches were deeply resistant. Now, I'm not making a political statement here. I'm describing it sort of from a social scientific, you know, institutional framework, how this sort of emerged. And the deep history of this is going to be that this could be along the lines of what Lisa was just describing, a kind of inflection point where we stop looking to sort of federal central coordination as the only means by which problems get solved, and the enormous potential for pressure to be placed on that central organization by these myriad networks of corporate sector interests, of educational and other social institutions, grassroots networks of all of the people that would be affected, right? And in the context of this, you know, the climate change one is so eerily correlated because it's this long-term, very distant, nebulous. It isn't obvious right now, except for a few, you know, people that are good at math. You know, most people don't understand the problem from the data. They think that then they can, you know, look at the data. I mean, even a week and a half ago, even right now, people are looking at the charts and looking at and starting to prognosticate that, well, the ventilators are overblown. We don't need that many, right? There's people that have no business making these declarations, doing, you know, backseat Monday morning quarterbacking about these things. So it just does strike me that the opportunities for those of us who think about what the resources are for the common good, what the principles require, that we have other avenues to look at than simply the elections, although the elections matter so much as this demonstrates.
One thing that I just bring in that I agree with what Lisa has been saying very much about the crucial importance of getting grassroots groups and people from the base of society to be able to have a voice in shaping all of this sort of thing. But at the same time, I think it's interesting to note that the person who I gather has the most credibility with the large number of Americans today on this issue of what should be done about the COVID crisis is Tony Fauci. And this man is an expert, a real expert about infectious disease. And there's been a very interesting back and forth, it seems to me, between his capacity to bring his expertise to bear, but it's also helped mobilize more sort of recognition that people have to wear masks when they go to the grocery store. And it's a kind of interesting combination of the grassroots that Lisa is talking about, people recognizing, I don't want to get this disease and I don't want to give it to somebody if I have infection already, and therefore you see a lot of people wearing masks around, walking around the campus here at Georgetown where I am right now. And but that's partly due to the kind of thing that has come from Fauci, and not from our government, but from our medical profession and the medical expertise in the public health area. So it's an interesting blending, it seems to me, of different layers of our society that need to be mobilized to try to take this kind of step forward toward the common good, especially when we get into the larger common good beyond the good of our own country. There's going to be a lot of need for people to be, if you will, have their to learn why they should be concerned about the degree of infection in Iran. And it's partly because it's a threat to our interests if Iran gets more infected. But that isn't spontaneously known. And it needs to be ways of communicating those things that are really important, it seems to me. That's where the academy and the church and the political sphere all come into play, it seems to me, in a very important way.
Right.
Yeah, one other potential sort of grassroots route into a sense of the common good is the sort of paradox that everybody is isolating and quarantined and social distancing for the sake of the common good.
Right.
Yeah.
And it feels very unnatural. I mean, we're all grateful, I guess, for Zoom and Skype, but I'd really rather be with all of you in the room talking right now than to be doing it that way. And it feels, it feels odd to all of us. And I think there's a sense in which it helps people at a very real existential day-to-day level to realize how much we need each other, how much we're connected to each other. And maybe that's the seed of awakening in everybody, the sort of sense that it is natural for us to be together. And this is really something that's unnatural and contrary to who we are as social beings.
One of the examples that I like to use in talking about the common good, I try to argue when I've worked on this issue that the common good is not simply the sum of a bunch of individual goods. And so it's not like everybody having enough food so that they can go home alone and eat by themselves, which is what we're doing now, or something like that. It's much better to have a dinner party with your friends, where the dinner is not simply my food for me, it's us together around the dinner table, and therefore it's a good that we couldn't have alone. You can't have a dinner party by yourself. You can have a meal by yourself, but the common good is more like a dinner party than it is like an individual package of food that I eat alone. It's something that we can only do together. And maybe, as Dan was saying, that this being isolated to some degree the way we are can give us an occasion to recognize that there are goods like that that we're also missing when we look at the healthcare system and when we look at the global environmental problems, and that there are a whole bunch of goods that we can only share if we have them together. And that maybe is an opportunity for helping people to wake up to some of the new challenges that we face for the common good today. And I think people recognize some of that maybe more now than they would have if they hadn't had this physical isolation that we're going through right now.
I think another issue, though, is who do you want to have a seat at your table? I don't think that there are many people who really want to be isolated. Everyone is solidaristic and collective in a way, but it's in what group? Yeah. And then within that group, we trust that certain facts are true. We trust certain authorities to interpret the facts. Mm-hmm. So why did Anthony Fauci come to have the authority that he has? Part of it is that people are immediately risked by the facts that he's talking about, and they want to know more, so they cannot just say, I've got an alternative set of facts that mean that I don't have to social distance, because there'll be a threat if they do that. We all know that going back to a few weeks ago or a month or two ago, not everybody was giving credibility to the fact that this was really serious and that we needed to take strong measures, that we needed to listen to good scientific advice. People wanted to believe it would be over. They wanted to believe that we could be very optimistic. Trump is even still saying he's not going to wear a mask and so on. But people aren't trusting that as much. Why not? Because the facts are showing that it's no longer in their self-interest to do that. So that's one issue that Grace already actually brought up. Right. And the other issue, though, is how do we care more about those who are not myself and my family? Yeah, so we already care for those in our solidaristic group, our identity group, but how do we expand our sense of who's in that so that they're invited to our dinner party as well?
Right.
If I could say something, it's somewhat related. So along with the disproportionate racial impact of COVID-19, we've been hearing about rates of domestic violence, or some people call it intimate terrorism, going up, right? And I do not have expertise in this field, but sociologists have said this is entirely predictable, because whenever you have families spending more time together, over holidays or summer vacations, you're going to have rates of domestic violence going up, right? And I think recently the UN Secretary General said we have to put the safety, not to say that only women are survivors of intimate partner violence, but we have to put women's safety first, which is to say, back to the common good. So social distancing, this is obviously in the interest of public health. It's also in, for the most part, people's individual self-interest, and yet this was entirely foreseen, but of course not intended, right? That you would have vulnerable, usually women, at a greater likelihood of being beaten, right, by their partners or spouses or whatever. So I just wanted to fold that in. It didn't fit organically with the other things.
I mean, that's really true. And it's not just that people are together more, but everybody's under stress.
Yes.
So I'm living in my house right now with 6 family members. So that's 7 people. And there are levels of stress that are going up, you know, as compared to a month ago. So we're all trapped here together, you know.
Yeah.
So you can see how if there were violence at all in the family history, that would definitely be exacerbated. And in fact, that came up back when Boston College first closed, because accommodations had to be made on campus for a certain number of students who could not return home. And it was for a variety of different reasons. But one of them was they would be going back to abusive situations.
Right.
So.
And that's the case here too at Georgetown.
Yeah, I was going to respond to Grace and say that in some ways there are going to be lots of different kinds of unanticipated side effects. And one of the things that has raised for me as being very important is that when we finally are on the other side of this, we really need to sort of figure out what we did, what went well, what went wrong, what those side effects were. Can we find a way when the next pandemic comes, and it probably will, to not ruin the economy in the midst of trying to do social distancing? Can we find ways to prevent increases in domestic violence when we're trying to protect the health of the public? And there will be untold kinds of things, and there's a real moral responsibility for the academy, for government, for medicine, for social scientists, to really sort of study this together so that we're prepared. And maybe from David's point of view, to recognize that diseases are global, we're in a global world, to make those efforts international as well.
I do think that one of the opportunities for ethicists in particular is to articulate all of the relationships to all of these different sectors and all of the infrastructure and all of the manufacturing and all of these questions of trade and cross-border movement and the like, how they do in fact manifest dimensions of this notion of the common good, and how we can help shape some of those policies. I often, my wife is in financial services law and policy and deals with the mortgage market, and I'm very interested in building and craft as a kind of moral enterprise. And I always joke around like, who do you have moral ethicists as part of the conversation in what the mortgage industry ought to look like, who should get a home, and it's a joke, but the reality is that this pandemic has demonstrated the depths of this, right? And as back to Lisa's earlier point, this is someday down the road will be an incredible teaching moment. It is a teaching moment for so many people who in the abstract could not grasp why the Affordable Care Act, for instance, or was important, why having healthcare insurance tied to employment might be a bad idea in the abstract, because, well, I'm employed, I'm never going to lose my job as long as I don't, commit grossly negligent acts. And then boom, 4 million people file for unemployment. It's going to go up. And there's lots of people now that are not going to have healthcare in the middle of a massive need for healthcare. That's a teachable moment. That's also requiring us to tether these things directly to the notion of the common good, while also, I think, thinking through the connections of what individual self-interest can be connected to, broader self-interest. or broader notions of other people's interests. You know, I'm a fan of Federalist 10 in a way, and you know, it's not, so I'm actually not surprised in the end that there's some you know, odd affinity groups that are emerging out of this crisis with the different factions, because you know, interests are dynamically mixed in these moments.
I do think that in the present situation, a lot of people, certainly not all, but a lot of people in the United States, and I suspect globally and other parts of the world too, realize that their own self-interest really is connected with the larger social good right now. Right. Because they know if we don't get this under control, they could die.
Right.
Yeah.
You know, that's pretty direct self-interest. And I think that's one of the reasons why we've seen a movement from large numbers of people not being sure how seriously this should be taken to a situation where most people, I think, recognize, not everybody, but most people, that we've really got to take this situation seriously, that this crisis really is a crisis. And it's not just a sort of an illusion that's been created by some group of people manipulating the media or something like that. And I don't know whether I'm wrong in that regard, but if it is true, then perhaps there are ways of building upon this crisis to say that we have the capacity and the need to move toward a larger, more integrated economic and social response to the health needs of people, both in this country and even globally. That we could build upon the recognition that our self-interest is involved in doing that in a way that without a crisis like this, we probably wouldn't have been able to do. Anyway, I hope I'm not wrong in that regard.
I hope so too, David.
Yeah.
So last thoughts, friends.
The common good is easier to define than it is to implement.
I'll co-sign that.
Yep.
Yeah.
Great.
One last thought, and for me, is that Thomas Aquinas says that the object of justice is the service of the common good. And if we really think that there are issues and duties of justice here, and I'm ready to support that, that we have some leverage, I think, that we could try to say that this is a moral challenge that really needs to be taken seriously by people working in ethics, but also the broader community, and how we think about the justice of our society, and how we can find ways to mobilize for greater service of the common good, out of a sense of our obligations of justice toward each other. And that's just one concluding thought I'd bring in.
I'll go back to something I said at the beginning about my notion of the common good in a holistic, integral sense, which is the sense that it's not really even best defined as self-interest per se in the way we typically think about it, but that my good is partly constituted by the good of the whole.
Yeah.
And this makes that clearer than anything has for Americans in a long time.
Yeah,
I think that's right. I will say that, you know, I grew up in the snow belt in the Midwest, a lot of lake effect snow, and we'd have a lot of snow emergencies where people were stranded. And my first impulse and what we would do, we had snowmobiles, and we'd, you know, load up supplies and take them to people and help. And there's a part of me that has had this deep-seated need to just, okay, what can I do? And that has been, I've had to confront the reality that any of that might further exacerbate the problem. It might imperil me. I might not, you know, I could become infected, or if I am infected and didn't know it, I could be spreading this in a way that has required the best thing I can do is to sit back and to be distant. And then at the same time, there's people like Dan, you on the front lines of this, and your colleagues in the healthcare professions who are risking a lot to be out there, and in some ways risking it for all of us. And so we really appreciate that. I can speak for everybody here, I'm sure, to say that. So
thank you. Thank you.
all right, well, thank you very much for this conversation, and thanks for joining us.